Hi, everybody. This is Regina Roberti with Life Transformation Solutions. I'm a certified health coach and sleep specialist. There are a lot of questions about what types of insomnia are going on out there. So I'm here just to talk about the types of insomnia that people may have and to talk a little bit more about a very unknown type of insomnia that is very rare. The first few people, pretty much have an idea of, they know that they have these symptoms. They're called sleep onset insomnia, sleep maintenance insomnia, or mixed insomnia. So sleep onset is when somebody struggles to fall asleep. They are lying in bed, no matter what they do, no matter how many techniques they try, falling asleep is near impossible. It can take them a few hours to fall asleep, or they may fall asleep for 1 hour, 2 hours, 3 hours, and then they wake up again. Sleep maintenance is when somebody has trouble staying asleep. And so they have no problems falling asleep. Falling asleep is actually easy for them, but something wakes them up throughout the night. And so they get a lot of broken up sleep when they wake up in the middle of the night. A lot of times they have trouble falling back to sleep because once they wake up, their brain starts wandering. They get distracted. Some people pick up their phone, and that's never a good idea because that LED light makes the brain believe that it's daytime. So staying away from phones during that time where you're waking up in intervals at night. Just keep it as dark as possible. Lay in bed until you fall asleep if you can handle it. If it starts to feel impossible to fall asleep and stress is starting to creep in because you're getting frustrated with yourself, just resign to the fact that you're going to be up, and that's it. You got whatever sleep you've got, and that's as good as it's going to get for that night. Mixed insomnia is when somebody struggles with falling asleep and staying asleep. And so that's got to be really frustrating. So you get the idea. Those are basically like the types or names of the most common forms of insomnia. There is a fourth type of insomnia called fatal familial insomnia. So this is the worst kind of insomnia that somebody struggles with, but this is such a rare genetic condition that most people struggling with insomnia do not have this type. You have to get genetically tested to see if you have the gene for it. But basically, what this is it's a condition that affects the central nervous system. It causes not only insomnia, but memory loss, also known as dementia. It is not Alzheimer's. That's a different disease process altogether. It can cause involuntary muscle twitching, not to be confused with restless leg syndrome. This gets worse over time. It can be life-threatening. Typically, somebody with fatal familial insomnia, they don't live to full term. What's happening is there are protein clusters on part of the brain that controls sleep, which is the thalamus gland. Early symptoms can look like insomnia. There has to be some kind of history available as far as inherently from a parent. There has to be somebody in the family that has it. This is a degenerative disease process. It gets worse over time. Right now, there's no cure, but treatment temporarily can slow down the progression. And, other types of symptoms of fatal familial insomnia are hallucinations, high blood pressure, tachycardia, and anxiety. So I don't want this bit of information to make you feel like you have this. Please talk to your doctor if you feel like somebody in your family has had this, they have a known diagnosis of this, then I would have some concern. But if nobody in your previous family has this, and rather than jumping to conclusions about yourself, because I know that insomnia can get really frustrating and it can get really scary for some people, don't automatically assume that this is what you have, because creating that sense of panic within yourself can only do one thing. It can make your insomnia worse. So if you believe that you have this, please check with your doctor. Please talk to somebody who's a geneticist. Make sure that you are getting tested for this specifically. There are very, very rare, seldom true, but rare cases where it does not present in the family, but it does happen to somebody. So they're born with it for whatever reason. There was some genetic damage to that DNA, and they get this. I mean, it's just like any other disease process, it's rare, but it can happen. So if this has helped you at all, please hit the like button. If you know people who are struggling with getting sleep, staying asleep, falling asleep, send them my way, send them to my YouTube channel for information regarding insomnia, different tips and tricks on what to do, what are the main causes of insomnia. I work with my clients on a regular basis, helping them get rid of the insomnia for good. It usually takes about one session with me to have my clients sleeping again. You can check out my Google review page on the results that I've been having with clients. They've all been sleeping really well. They are enjoying life again, and anything that was related to the insomnia has also gone, and so they are experiencing multiple benefits. They're very excited to live a different life than what they've been struggling with, and so I would like to be able to help you too. Once again, my name is Regina. I am the founder of Life Transformation Solutions. You can visit my website at lifetransformationsolutions.com. I'm a certified health coach and sleep specialist. Hope you have a great day.